Liver failure. Definition. Liver failure is the inability of the liver to perform its normal synthetic and metabolic functions as part of normal physiology. Two forms are recognized: acute and chronic cirrhosis. Recently, a third form of liver failure known as acute-on-chronic liver failure, ACLF, is increasingly being recognized. Types of hepatic failure. Acute liver failure, also known as fulminant liver failure. Acute liver failure strikes fast. In this, patient experiences loss of liver function within weeks or even days. It may happen suddenly, without showing any symptoms. Common causes of acute liver failure include poisoning from mushrooms or drug overdose, which can occur from taking too much acetaminophen, Tylenol. Chronic liver failure. Chronic liver failure develops more slowly than acute liver failure. It can take months or even years before client exhibits any symptoms. Chronic liver failure is often the result of cirrhosis, which is usually caused by long-term alcohol use. Cirrhosis occurs when healthy liver tissue is replaced with scar tissue. During chronic liver failure, the liver becomes inflamed. This inflammation causes the formation of scar tissue over time. As body replaces healthy tissue with scar tissue, liver begins to fail. There are three types of alcohol-related liver failure. Alcoholic fatty liver disease. Alcoholic fatty liver disease is the result of fat cells deposited in the liver. It generally affects those who drink a lot of alcohol and those who are obese. Alcoholic hepatitis. Alcoholic hepatitis is characterized by fat cells in the liver, inflammation, and scarring. According to the American Liver Foundation, up to 35% of people who drink heavily will develop this condition. Alcoholic cirrhosis. Alcoholic cirrhosis is considered the most advanced out of the three types. The American Liver Foundation says that some form of cirrhosis affects 10 to 20% of people who drink heavily. Causes. A variety of causes are associated with liver failure. Causes associated with acute liver failure. Acute liver failure, also known as fulminant hepatic failure, can occur even if people don't have a pre-existing liver disease. Acute liver failure may also be caused by certain prescription medicines, some herbal supplements, viral infections, such as hepatitis, including hepatitis A, B, and C, toxins, certain autoimmune diseases. Acute liver failure can be genetic, passed along by an abnormal gene from one or both of parents. If client has a genetic liver disease, he is more susceptible to liver failure. Causes associated with chronic liver failure. Chronic liver failure is usually a result of cirrhosis or alcohol-related liver disease, ARLD. The American Liver Foundation states that alcoholism is the most common cause of cirrhosis. Usually, liver breaks down any alcohol that is consumed. But if client drinks too much, liver can't break down the alcohol fast enough. Also, toxic chemicals in alcohol can trigger inflammation in liver and cause liver to swell. Over time, this damage can lead to cirrhosis. If client has hepatitis C, he is at greater risk of developing chronic liver failure or cirrhosis. The hepatitis C virus is spread through the blood. If the blood from a person with the infection enters healthy body, it can catch it. Needle sharing and using dirty needles for tattoos or piercings can spread hepatitis C. Unknown causes. It's also possible to develop liver failure without an identifiable cause. Symptoms of hepatic failure. Symptoms of liver failure may include nausea, loss of appetite, fatigue, diarrhea, jaundice, a yellowish color of the skin and eyes, weight loss, bruising or bleeding easily, itching, edema, or fluid buildup in the legs, ascites, or fluid buildup in the abdomen. These symptoms can also be attributed to other problems or disorders, which can make liver failure hard to diagnose. Some people don't show any symptoms until their liver failure has progressed to a fatal stage. Client may be disoriented, drowsy, or even slip into a coma by the time reached this stage. Diagnostic evaluation. History taking, alcohol abuse, genetic abnormalities, or other medical conditions. Physical examination, jaundice, neurological assessment, ascites, enlarged liver, itching. Blood screening tests can be done to detect any abnormalities in the blood, including abnormalities that may imply liver failure such as serological test for hepatitis, CBC, blood biochemistry. Liver function test, to identify the various enzymes. Biopsy is a common test used to determine liver damage. During a liver biopsy, a small piece of liver is extracted and examined in a lab. CT MRI X-ray, to visualize the presence of tumor, cirrhosis, stone, etc. Management. Treatment is supportive as the liver failure may resolve if it is acute. Specialist hepatology input is essential. Ideally, patients should be managed in a specialist liver unit. Positioning at a 2-0 head-up tilt can help ameliorate the effects of cerebral edema. Monitoring of intracranial pressure may be necessary in severe encephalopathy. Whilst adequate nutrition is essential, the protein intake should be restricted to 0.5 gkg day or less. Lactulose and phosphate enemas may be used to empty the bowel and minimize the absorption of nitrogenous substances. Oral neomycin can decrease enteric bacteria. Sedatives should be avoided. Any treatable cause, e.g. paracetamol overdose, should be managed appropriately. Complications should be anticipated and avoided wherever possible. Regular monitoring of blood glucose and 10% dextrose infusions are used to avoid hypoglycemia. Other electrolyte imbalances should be corrected. Coagulopathy should be treated with intravenous vitamin K, although this may not be effective due to poor synthetic liver function. Fresh frozen plasma should be avoided unless active bleeding is present or prior to invasive procedures, as it can precipitate fluid overload. Anti-excretory agents, e.g. H2 antagonists or proton pump inhibitors, may reduce the risk of gastrointestinal hemorrhage. Renal support may be necessary. Dialysis. Systemic antibiotics and antifungals may be used to prevent sepsis. Liver support using cellular and non-cellular systems are under development. However, liver transplantation remains the treatment of choice if the patient fails to improve. Prevention. One of the easiest ways to prevent liver failure is to moderate drinking. Other preventive measures include practicing safe sex, not engaging in drug use or needle sharing, getting vaccinated for hepatitis A and B, protecting skin from toxic chemicals, using aerosol spray cans in ventilated areas so that people don't inhale the fumes.